When it comes to treating your thyroid naturally, one of the micronutrients that's super important is selenium. Selenium has been getting a lot of attention because of all the great benefits, but as important as selenium is, you should also be aware that it's easy to experience selenium toxicity. So in today's video, which is just really a great video on this topic of selenium, I want to review with you all the benefits that selenium provides to the thyroid. I want to talk about the signs of selenium deficiency. I want to talk about the symptoms of selenium toxicity or overdose, and I want to also talk about the foods that are high in selenium, and finally, how selenium benefits the thyroid gland and benefits those people with Hashimotos and Graves and so on and so forth. Right? You see, not only does selenium help your thyroid, but it helps your immune system, it helps your hormones, it helps your metabolism, it serves an important antioxidant within your body. And I'm going to explain why antioxidants are so important to those people with thyroid disease here shortly. But for those of you that have Hashimoto's disease, or you have thyroid nodules, or you have Graves' disease, right? Very, very important. Now, if you're just joining for the first time, I want to welcome you to my YouTube channel, right? I'm Dr. Hagmeyer. I'm the clinic director here at drhagmeyer.com, where we help patients from around the world. We help them find answers. We help them find solutions to their thyroid problems using functional and lifestyle medicine. Our motto here is that you can't fix something if you don't know what caused it in the first place. Okay? So let's jump into today's video because there are so many things that you need to know about selenium before you start taking it, right? It's obviously no mistake that the highest concentration of selenium is in the thyroid gland, all right? It's no mistake that happens, right? Selenium is the building block for various proteins and various enzymes, and specifically selenoproteins or selenoproteins, depending on how it's pronounced. The first benefit I want to talk to you about selenium is the role that it plays as a powerful antioxidant, right? Antioxidants, these protect your cells from the damaging effects of free radicals. If you take a look at this picture here, I like to use an apple as an analogy when explaining this to my patients. Think of an apple here for just a moment, right? You have this outer skin of this apple, and the purpose of that skin is really to protect the apple, protect the inside contents of that apple. But what happens when you take a bite out of that apple, right? Within just a few minutes, what happens? All right, well, if you're like anybody in my family, you put an apple on the table, you walk away from it, and within minutes it begins to turn brown. It quickly oxidizes the sugars and so on and so forth. It just essentially breaks down. And this is why it turns brown. So after only a few minutes of being exposed to the air, we see this deterioration process, right? Well, the skin of the apple, as long as it's not broken, it protects the inside and prevents the apple from rotting. In the same way, the cells of your body, they have an outer cell membrane, much like the skin on the apple. But under the influence of excessive free radicals, these free radicals, they damage the cell membrane. This is where antioxidants like selenium, they come into the equation. Selenium and glutathione and some of these other antioxidants that I've talked about in my videos. You see, selenium protects your cell membranes, and it protects it against the damaging effects of this oxidative stress. So this antioxidant benefit of selenium and the selenoproteins is super important for those with Hashimoto's, those with Graves' disease, those with thyroid nodules, and even those people with thyroid cancer, because these individuals are more prone to the damaging effects of oxidative stress. The second benefit to selenium as it relates to thyroid function is its ability to delay the progression of ocular disorders, right? This is especially important for those patients with Graves' disease or hyperthyroidism. These people often have changes to the structure of their eye. And this is obviously what causes the eyeball to protrude, and that can be very embarrassing for a lot of people, right? So again, selenium has been shown to help with that. For patients with autoimmune thyroiditis and people with Hashimoto's, the research also shows that selenium can reduce your thyroid peroxidase antibody levels. Research shows that it improves ultrasound, the structure and the integrity of the thyroid gland on ultrasound. It's been shown to improve, ultimately, quality of life, right? So you might be thinking, well, I don't have Hashimoto's, I don't have Graves' disease. But here's the thing. Maybe your doctor told you that you have low T3 levels or that your free T3 levels were low, right? This is one more way that selenium can benefit your thyroid gland. You see, selenium helps your body take the inactive thyroid hormone, T4, and it helps convert it into T3. you see people with low selenium levels often also have low T3 levels. And again, that's the important hormone that we want to monitor and measure as it relates to thyroid function. Now, if you've had your blood work, you may notice that your TSH levels are high. Or maybe if they're not high, maybe they're just a high normal, right? And so your T4 levels are on that high normal range or that high level. But if you have, and you look at your T3 or your free T3 levels, what you're going to see is if they're low, that's a pattern that we call thyroid underconversion, right? This is a pattern where, again, we have high or normal T4 levels, but our T3 levels, or free T3 levels for that matter, they're on the low end, right? So sometimes you hear this being referred to as low T3 or T3 syndrome or euthyroid or even thyroid underconversion. And again, this is a pattern where we see that the thyroid gland is not capable, or the body for that matter, is not capable of converting T4 into T3. Now, the big problem with this is, of course, that this puts you at greater risk of the production of scar tissue within your thyroid gland. And having scar tissue in your thyroid gland, that's not a good thing, because the more scar tissue that you have building up in your thyroid gland, the less functional the thyroid gland becomes, or at least a portion of that thyroid becomes non-functional. So those are some pretty convincing reasons why selenium supplementation really should be considered if you have Graves' disease, or if you have Hashimotos, or if you have oxidative stress, or on blood work, your TSH is high, your low T3, maybe your T4 is on the high or normal end. These, again, are all signs that you're not properly converting T4 into T3. Now, before you start thinking about taking selenium or eating foods that are high in selenium, like Brazil nuts and shellfish and so on and so forth, and we'll get into a lot more of those foods in just a minute, there are a few more things that I really want you to be aware of, such as the symptoms of excess selenium, or symptoms of selenium deficiency as well, for that matter. So here's the thing. A few weeks ago, I had a new patient with thyroid disease start care in my office, right? She had all of your typical thyroid symptoms. But because she had read about the benefits of selenium, she just started eating and incorporating all these foods that are high in selenium into her diet. And she was having anywhere between 3 and 5 Brazil nuts every day. She was eating foods, again, high in selenium, like pork and eggs and shellfish. And she was supplementing with selenium supplements, right? And so when I looked at her diet, which I have all patients do, I have them fill out a 7-day food journal so I can understand what they're eating. And I also have them fill out a list of supplements that they're taking. When I looked at both of these in conjunction with everything that, she had going on, I felt it was just a good idea. It couldn't hurt just to have her selenium levels checked. And so we checked her selenium levels just to see if maybe she needed more selenium, maybe she needed less selenium, whatever, right? But, as most things in our culture, most people think if 1 is good, then 3 is even better, right? And that's just kind of how we think. And so her levels came back and they were off the charts. And once again, it proved to me the value of testing, right? You see, while low levels of selenium certainly pose concern, high levels of selenium or excess selenium, or even selenium toxicity for that matter, is more damaging to your thyroid and more damaging to your immune system and more damaging to the tissues of your body than low levels, right? The main symptoms of selenium toxicity that you should really be aware of, and this is in no particular order, but these are going to be things like a garlic odor, or a metal taste in your mouth, or anxiety, or hair loss, or irritability. Maybe you have trouble sleeping, you feel wound up and agitated and irritable. And then skin rashes. Now, of those symptoms, this patient that I started working with, she did have anxiety, she did have hair loss, she did experience brain fog, and she did have skin rashes. But here's the thing. Many patients with thyroid disease experience those symptoms. And I only knew to obviously test her selenium levels and even consider testing her selenium levels because I knew A, she was eating them, and B, I knew that she was supplementing with it again. So again, the thing about this is don't be fooled over the fact that selenium toxicity doesn't exist because you don't have those symptoms of, of smelling like garlic or, that you have a metal taste in your mouth, right? You can still have selenium excess without those symptoms, right? So with all this being said, don't let this discourage you from taking selenium, right? Selenium, like all vitamins and all minerals, are incredibly safe when compared to medication, right? Just need to know that if you're taking selenium, you need to know how long you're taking it for, why you're taking it, how much of it you're taking it, why you're taking it in the first place, right? Because if you're going to use food and you're going to use supplements as medicine, you need to be aware of the fact that when you take things at certain levels, they do influence your physiology. So you need to be aware of this, especially when you start monitoring your T4 and T3 levels. And that brings us to the next point, which is if you are going to use food as medicine, you want to make sure that you have baseline levels so that you can see and monitor what kinds of changes are happening. Now here's the thing, if you're finding this information in this video helpful and you like it, do me a favor. Hit that like button, hit that subscribe button. This helps me know if the information that I'm providing and I'm putting out there is good information, and it helps me to know that, hey, I should keep making videos like this, all right? So keep in mind this, when you use food as medicine, I'm gonna say this again, it needs to be monitored like medicine, right? So just be careful again with those Brazil nuts, because each Brazil nut contains approximately 90 mcgs per nut. So if you have 4 or 5 Brazil nuts a day, every day, and you're taking selenium supplementation, you can see how easy it is to become overdosed. Now here's the thing, if you look at most resources and most sources on the matter of selenium, what you're going to find is that selenium dosages should be anywhere between 200 to 500 mcgs of selenium pretty much on a daily basis. So now there are other foods, and of course, that we can eat that contain selenium, things like red meat and, like I said earlier, shellfish, rice, yeast, organ meats. So there's a lot of these foods that can bolster up your selenium levels. But in some cases, if doing those things doesn't help, selenium supplementation is probably the best way to go above Brazilian nuts, okay? So now that you know about the foods that contain selenium, how much selenium your body needs on a daily basis, you might be wondering, what are the symptoms of selenium deficiency? Low levels of selenium, right? So these are going to be things, whenever I think about low selenium, I think about low T3 symptoms, right? And that's your typical hypothyroid symptoms, right? Remember what we said earlier. T4, or I should say selenium, helps your body convert T4 into T3. So again, selenium deficiency, think low T3 symptoms. And again, those are going to be things like weight gain, brain fog, fatigue, hair loss, brittle hair, brittle nails, brain fog, maybe some constipation, feeling cold all the time, that outer 1/3 of the eyebrow begins to thin or disappear on you, and then of course infertility. So there you go. I hope you liked today's video. As always, I hope you learned a few new things, and now it's your turn. I want to know and I want to hear from you. What's been your experience with selenium? Has it helped you with your Hashimotos or your Graves' disease? How about low T3? Has it helped your body convert some of that T4 into T3? Were you aware of the symptoms of selenium toxicity and perhaps I don't want to say the dangers of Brazil nuts, but how easy it is to get overdosed with selenium if you're eating Brazil nuts, right? Drop me a comment below. And again, if you like today's video and obviously you want to hear more educational content like this, consider subscribing and turning on the notifications to my YouTube channel, all right? Well, there you go. Till next time, I'm Dr. Hagmeyer. Take care.